All right, so as we wait another couple minutes, for those who registered to join, I'm starting a poll with just a couple questions to see who's joining us on the webinar, what your roles are, and curious to know how often you encounter or work with pregnant and parenting youth throughout your week. So go ahead if you're at a computer right now and fill that out. Thank you. All right, we'll go ahead and begin. So thank you so much for joining us today for the webinar, Introducing the Pregnant and Parenting Youth Inclusivity Toolkit. My name is Brittany Battelle. I use she, her pronouns. I work as the Program and Engagement Manager at the Michigan Organization on Adolescent Sexual Health, and we're very excited to be able to share this newest resource with you. If you're just joining us, we've got a poll going right now just to see who's on the webinar, what role you're joining as, and just so I'm familiar, how often you encounter or work with pregnant and parenting youth on kind of a day-to-day basis. Right now, looks like we've got mostly health professionals and teachers and educators. That's wonderful. There's going to be a lot of stuff in there that I'm hoping will be helpful to you in your work. We've got service providers, parents. In terms of how often folks encounter or work with pregnant and parenting youth, looks like most of you are saying sometimes, frequently. A couple people say they work all the time with young parents, which is fantastic. That means you're going to have a wealth of experience. Hopefully a lot of what we're going to encounter in terms of the toolkit content will be familiar. And we also welcome any feedback you might have about tips that you've learned while working with this population that we can incorporate in the toolkit going forward. So I'd love to hear your thoughts after this. And here you can see who we've got going. So before we delve into it, just wanted to make sure you're familiar with who we are and kind of the work that we do. So we're the Michigan Organization on Adolescent Sexual Health. We mobilize youth voices, engage community partners, and inform decision makers to advance sexual health, identities, and rights. We're a statewide nonprofit that was founded back in 2008. And the work that we do across the state falls under 5 main program areas. These include promoting youth access to healthcare services, work around consent, sexual assault prevention, and gender-based discrimination, LGBTQ+, inclusivity and affirmation, sex education, and then supporting pregnant and parenting youth, which is the work we're going to be focusing on in today's webinar. Also, you may be aware that today is an awareness day that we host called the Michigan Youth Parenting Awareness Day. It falls on the 4th Friday in March, which is today. This awareness day, we started it a couple years ago, so this is the 3rd year that we're celebrating it. It was created to recognize and honor the pregnant and parenting teens in Michigan and provide them with an opportunity to share their lives and accomplishments. So MyPad is giving young parents a platform to build community connections, reflect on their experiences, assess their needs in different areas, including education, employment, interpersonal relationships, healthcare, finances, housing, etc. Giving them an opportunity to develop an awareness-raising agenda for programs and policies that will help themselves and their families thrive, and of course engage in activism. Every year we hold this, we do things a little differently, but consistently we've offered an organizer's toolkit. So if people want to learn more about the purpose behind this Awareness Day, different ways to raise awareness for young parents, virtually or in person, different initiatives that are really important for young parents, the toolkit is a great comprehensive guide to look through. We also always host a social media photo campaign in order to boost the visibility of young parents in our communities. So here you can see a couple photos we've got coming in. The one on the right is parents and a family from one of our Michigan Adolescent Pregnancy and Parenting Program grantee sites in Eaton. And then on the left, we've got a picture that we took just yesterday. We're very grateful to Representative Hertel in the Michigan Legislature for sponsoring an official Youth Parenting Awareness Day resolution. So just yesterday, House Resolution 51 was adopted. We had a number of co-sponsors officially recognizing today as MyPad. The other two initiatives that MOASH is involved in this year is going to be two different webinars. So this is the first one, and then we've got another webinar coming up on Monday, which is going to look at teen parent representation in graphic art. For those of you who have been involved in, say, MOASH's Consent Day, that's another awareness day that we organize. If you're familiar with the virtual book club we did, this upcoming webinar on Monday is going to take a bit of a similar structure, and that we're going to be looking at a graphic novel that was written by a teen mom. And then we'll also look at some graphic art that Cole Williams, one of our MyApp program partners, and MDHHS partners, has been developing around looking at teen dads as superheroes and sharing those graphic representations. So I hope you can join us for that. We'll talk a little bit more about the details at the end of the webinar, but just to get that on your radar. We first developed this Awareness Day in connection with MOASH's partnership with the MyApp program. Again, the Michigan Adolescent Pregnancy and Parenting Program. This is a program of the Department of Health and Human Services. And since its inception in 2014, MyApp has made some great strides in its 5 different community sites, so 5 grantee agencies across the state, who engage expectant and parenting teens, young fathers, and their families in a system of care that improves educational, health, and social outcomes for the participants. One of the great things about this program that I really appreciate is they take a strengths-based approach with young parents. So they've got a really wonderful staff of case managers and then other community partners that ensure that expectant and parenting youth get the supports they need to pursue their personal dreams while building happy, healthy, and thriving families. MOASH partners with MyApp in a couple different ways. First of all, they tap us to create some awareness-raising materials. So we've developed a number of fact sheets around teen parent rights in the areas of education, healthcare, and parenting rights. Another thing MOASH does with MyApp is coordinate biannual learning collaboratives. So each year we host one learning collaborative for MyApp grantee agency staff as a professional development opportunity to come together, share experience, talk about what's working with their programs. And then we also host an annual learning collaborative for young parents across the state. Previously, this was only for MyApp grantee agencies. However, beginning last year, we have now opened this up to be a statewide learning conference. So anybody, any expecting or young parent across the state is welcome to attend. It is now called the You Thrive Teen Parent Summit, And our next summit is coming up in May 10th. Registration will open for this on April 1st. So for those of you who say you work sometimes or frequently or all the time with young parents, we encourage you to see if you can bring a group. It's a really wonderful day full of different breakout opportunities, just networking, hangout time with young parents where they can share experiences and make connections with other youth who understand what they're going through. We're going to have a lot of resource tables talking about different educational opportunities. And we're also going to have a panel of former teen parents talking about their personal journeys and how they've navigated different challenges. So it should be a really wonderful day. Now to get into more specifically about this webinar and introducing the toolkit. One of the questions we'll frequently get is, anytime, I think, when you focus on a specific population, why this group? Why are we focusing on inclusivity for young parents? I think in the sexual health field, teen pregnancy prevention is one of our major initiatives. And it's a very valuable initiative, and Michigan specifically has made incredible strides in this field in reducing the teen pregnancy rate. In these initiatives, one of the strategies that we use is talking with young people and getting them to think through decision-making about what do they want their lives to look like. If they decide to become parents, being real about the challenges that are going to come along with that, and make sure they understand what that might look like for them so they can make an informed decision with their reproductive choices. What kind of ends up happening sometimes is, in our efforts to be real about these challenges and unintended consequences, is that we may end up shaming or stigmatizing young people who have become parents. So I think it's important to kind of understand how this unintended consequence plays out. So here you can see a few different graphics that have been developed by these teen pregnancy prevention programs. These are not from Michigan. These are from different states. And you can see here that they're not always very supportive of young parents. If you look at the middle one, it says, "Give it up for teen pregnancy." And then there's a list of things that ostensibly a young parent is going to have to go without if they pursue parenthood. So giving up going to college, giving up people thinking you are smart, giving up your free time, giving up relationships with people, which is a really difficult thing to start to consider. Most of these graphics, they're not geared toward young parents, right? They're geared toward other teens. The thing is, young parents are still seeing these graphics. And so if you can imagine for a second being a young parent who's trying to continue their education or pursue their career, arrange for childcare, make sure that their children are getting their healthcare needs and other emotional needs met, and then being bombarded by this messaging that you have to relinquish these dreams as if there's no other options going. Other graphics on the left here, you can read through them at your own leisure, but these, even though they're geared toward teens who haven't had a child yet, they start to sound as if they are talking specifically to young parents. So like the top left one says, "Dad, you'll be paying to support me for the next 20 years. Or the one below it, "Honestly, Mom, chances are he won't stay with you. What happens to me?" I believe that the intent behind these graphics was positive. They were trying to get them to think about the consequences and think about the future. However, how it plays out is it can be very, very disheartening to young parents who are hearing over and over that you can't achieve your dreams because you have had a child. So with all these messages coming up, I mean, these are posters that were on telephone booths and in the subway. We also can hear these messages in classes, through the media, in doctor's office, at homes. Over and over again, these small messages really add up to being really emotionally burdensome for young parents. So I think the idea to keep in mind is there should be a balance. I think there's a way where we can support teen pregnancy prevention programs and these unintended pregnancy prevention efforts and support young parents at the same time. There are ways to do this without being shaming or being negative about teen parents' future prospects. So with this challenge in mind for us as educators and the work we do through sexual health and sex education in MOASH, we started to consult with our MyApp program partners about how we might be able to give people better strategies and better messaging that supports young parents at the same time. So that's when we developed this idea to put a toolkit together. This wasn't a new project necessarily. We had done something similar when it came to LGBTQ inclusivity. MOASH had developed a toolkit. It's available online, specifically geared toward Michigan health teachers. Within this toolkit, we had kind of shared some information about health disparities with LGBTQ youth. We had talked about concrete language changes that could be made, simple alterations in lesson plans, so we weren't shaming LGBTQ youth during these health lessons. So we figured, okay, this is a nice format, you know, it's very accessible, so we could probably put something together and focus specifically on pregnant and parenting youth instead. So we brought this idea to our MyApp planning group, and they said, yes, I think this would be a valuable resource. MOASH is coming at it from kind of like a sex education lens. We also think that an inclusivity toolkit would be beneficial for others who work with young parents. So not just health teachers, but also service providers who are in assistance offices that pregnant parenting youth are going to be accessing. Relatives of pregnant and parenting youth who want to help and have really good intentions, but may not be using the best strategies from a strengths-based perspective. So we decided that as we took this project on, we really wanted to broaden our audience to be any adult who may find themselves working with pregnant and parenting youth. So we began this project last year in the fall. We put together a draft, and then I have to say thank you to all the different parties who looked this over, who gave feedback, and have really turned the current iteration into what it looks like today. So those people are Hillary Brandon, who's the MyApp program coordinator, Christopher Robinson, who's an MDHHS contractor who does a lot of really amazing work with fatherhood programs. We also felt that it was critical as we did this work to get the feedback from young parents to make sure that we were accurately representing their challenges and felt like, yes, these are strategies that we would like to see other adults adopt that are going to help us the most. So we reached out to our MyApp agency sites and had some young parents at Stepping Up Together, that's the program in Eaton-Risa, and then also parents at the Saginaw ISD MyApp site look it over and provide written feedback. Lastly, as with all of MOASH's programs and initiatives, we had our Youth Advisory Council look it over and provide feedback. So again, making sure it was accessible for youth and represents their experience accurately. So for the rest of the time, what I want to do is kind of walk you through the Pregnant and Parenting Youth Inclusivity Toolkit as the current draft stands. We are hoping to release it and make it available via our website, downloadable to the public very soon. It still needs to go through a review process by MDHHS, but after a few weeks, we should have that up and running and available to you all. The format of the toolkit as it stands right now, it's pretty short. It's 8 pages. We extended a lot of the text out and put together graphics so that it was going to be very approachable in that sense. What's included is an introduction to the topic of pregnant and parenting youth inclusivity. We wanted to share some data and statistics that we've collected around young parents so people really understand the issues that they're at the heart of their lives. We included some general overarching principles for inclusivity. So guidelines about what that really looks like and the overall sense and tone that we're coming at this with. Then we drill down to more specific, concrete suggestions for inclusive terms and language. So again, the LGBTQ plus inclusivity work we've done is a really nice analogy. We've seen how doing things like asking people about their gender programs, or when we use examples of families using more than heteronormative examples, and that small indications to be more inclusive, and cumulatively these small language changes can make a really big difference. So the same is true with pregnant and parenting youth. Lastly, we also put together, we wanted to address some of the myths and stigma around teen parents that are out there. I think it's important to recognize the narrative that's kind of pervasive in our culture, and also know simple ways to be able to respond to that and kind of interrupt some of those narratives which end up being very damaging and harmful to young parents. Lastly, we put together a short list of resources so others who are interested in this topic and want to learn more have an idea where they can go to get more information. So without further ado, let's go ahead and take a short walk through our toolkit here. So as we say, the audience for this is very broad, which can make it difficult to write for, but teachers in classrooms, families and relatives of young parents, other service providers at different agencies within the community who may have young parents as clients. We all hope that there's something in this guide that will help them learn how to make their environments and their interactions welcoming and supportive for young parents. We've included a short introduction to talk about our process and the tone of our work when it comes to pregnant and parenting youth. I think it's a good balancing act, or it's a balance that we need to hit between acknowledging young parents' struggles, making sure that there's an awareness of the additional unique challenges that young parents are facing. Some of you may be very familiar with what these look like, but others may not be. And so we wanted to include just some of the information, some of these common issues and concerns that come up, because having that awareness is a next step to knowing what you can do to be an effective ally to young parents. However, as we present these challenges, we want to be careful that we're not echoing many of the negative perceptions and stigma around young parents. Overall, the tone we want to use is one of positive youth development and a strengths-based framework. We really want to highlight young parents' capabilities and the joys that they do find in their life. That's not a narrative we hear as often if we don't work directly with pregnant and parenting youth. But it's very important to be able to put this in a little better light than we're used to seeing, because there's a lot of really wonderful things to be found there. So we thank anybody who's on this webinar and who might be accessing this toolkit for kind of saying like, yes, I want to better myself. I want to know what I can do, and seeking out this information. So here's the first slide when it comes to raising awareness for young parents' needs and challenges. The caveat here is we're going to present data as it stands about some of the difficulties that they face, but we want people to be aware that when we provide them with additional support, we see a lot of these, difficult outcomes being reduced or eliminated. The MyApp program is an exceptional example of when you intervene in effective strength-based ways and provide guidance and other assistance to young parents, they can thrive. If you want to find out more about this and specific data points as it comes to different health outcomes and areas of work with young parents, I encourage you to check out an infographic MOASH put together about the MyApp program. It's just a 2-sided sheet. There's a link there. It's bit.ly/MyApp infographic as an example of one program that's doing exceptional support work. So we've broken down these statistics into 3 main categories of issues with young parents that come up very frequently. The first one is in education. School push-out of young parents is a major concern that we're looking at. Many young parents report that once they become pregnant or expectant, not feeling as supported by their schools to continue their education. There's a lot that they need to do in terms of prenatal care. They may find that with a young newborn or a young infant, they have to coordinate different doctor's visits and childcare. And, there's lots of pressures that weren't there before in order to continue their education. I'd like to mention that young parents and pregnant and expectant teens do have Title IX protections in place. So schools should be cognizant of their responsibilities in still making sure that young parents can continue their education. If you'd like to know more, again, MOASH has an infographic about education rights of young parents. The second category is financial considerations. So a lot of young parents are struggling financially and may not receive the support that they need. As they continue their education, they're looking to find quality childcare services that they can access, or calling on relatives or other supportive adults in their community to be able to watch their child while they're going to school or while they're going to work, and starting to learn new skills around gaining employment, maintaining a steady job, or just continuing their work in high school or higher education opportunities. Finally, a category that we look at is this idea of a need for social support. Teen pregnancy is a bit of a taboo topic right now. So many young parents report experiencing a sense of isolation from their peers because they're taking on these new responsibilities that other young people their age may not be. They may see reduced visibility in the community if they're at home with their child or are working on different things. And so there's a sense of loneliness that comes along with the teen pregnancy. This can lead to more defined mental health concerns, including postpartum depression, general depression and anxiety, higher reported levels of stress. These may look different depending on the young parent. So I know a lot of times young moms may struggle with depression and anxiety. Young dads that we work with talk about experiencing more psychosomatic symptoms, so headaches, stomach aches, things like that. We also hear a lot from focus groups that we've done with young parents in the MyApp programs about how sometimes there's a wedge driven in some of their social interactions, how parents of their friends will tell them not to hang out with them anymore. Also experiencing small microaggressions about people talking with their parents and not with them about parenting their children. And that can be really difficult to feel like I'm taking on these adult responsibilities, but I'm not receiving the respect and support that I would expect to come along with that. So these are all things to keep in mind as we work with young parents and underscore the importance of providing additional support during this time. So here we have general guidelines for working with pregnant and parenting youth. We put together a list of 5. Again, these are overarching general principles. They're not as concrete, but they really are driving forces for effective work with pregnant and parenting youth. The first one we list is the idea of treating young parents with the same respect that you would have for any other parents. I think about older parents. Whenever we learn that they're going to become new parents, there's usually an outpouring of support for that. We talk about, yes, it's going to be hard, but I'm here to help. You're doing great. You're learning about this. And sometimes those messages don't come out with young parents, and that's really a shame. We should afford them the same respect as we would anybody who's made the decision to become a parent. So a good way to go about this is not trying to either distance yourself from them as parents. So saying, you need to figure it out on your own. I'm not going to help you. They do require guidance, as anybody would when encountering a new challenge in life, but also making sure that we're not trying to take over parenting responsibilities for them, that we're not dictating how they're supposed to parent based on our own conceptions. I recommend asking them what they want, what they need, helping them problem solve as things come up, but not treating them as if they're unequal to the task of parenting. So steady encouragement, gentle guidance, always a good principle. Secondly, we want to be positive about young parents' strengths and goals as parents and as individuals. Young parents, like everybody, need somebody to believe in them. Especially when they're getting bombarded by all these shaming signs like we saw on a previous slide, these random comments about teen parents. We need to be a different voice of positivity and guidance. So letting them know that as they encounter challenges, they're capable of overcoming them, providing different strategies to do that, and building their sense of self-efficacy to take this on. Third, we want to mention specifically the inclusion of young fathers. So often we focus on teen moms. A lot of programs are around maternal and infant health, but young fathers are an integral part of their child's life, and they would like to be. And we need to make the assumption that young dads want to be involved, and they're going to need the same supports when it comes to navigating school and work and different financial things that come up. MyApp is a great example of a program which is focused on young fathers specifically and really made efforts to engage them. I want to credit people like Christopher Robinson, Cole Williams, Tori Jackson, Travis Neller, and Charlie Patterson, who are part of the Fatherhood program, which put together these barbershop talks where young dads come together and feel safe and supportive and are able to talk about their struggles. And of course, their triumphs and achievements when it comes to being a good father. Many young dads, we're told, feel kind of a pressure to provide for their children. They want to do that. They want to be present. They want to be present in their lives. And sometimes they struggle because there are many other commitments. If they're seeking employment while going to school, that means that their time may be taken up and they may struggle to find hours in the day to come and play with their children. So speaking to that and helping them find ways they're able to find a balance. The fourth principle is just being familiar with young parents' specific needs. So we already went through some of the data and statistics that we see around that. But just being aware, if you work with young parents, that they're going to have many different commitments, and they may have more barriers when it comes to getting to a particular event or appointment. All young people, I think, struggle with transportation issues. When you're transporting a baby or an infant, that's additionally difficult. Thinking about strategies to reach young people is always important to consider. Email may not be the most effective way. A lot more often phone or texting, reaching people via social media messenger is a great way to do it. We need to make sure that we're sharing messaging about self-care with young parents because they're experiencing a number of different stressors and struggles. And of course, thinking about arranging childcare with any events that you do. We know that it's difficult for young parents to make commitments if they aren't able to bring their children, or if they don't know who can care for their children to be able to attend an event for themselves. So considering this, if you're trying to set something up involving young parents, is you're going to need to take a few more of these things into account. And finally, always assuming any group you may be working with is diverse and that there are many intersecting identities to keep aware. You may work with young people who are parents. It's not always a visible identity. So it's important when you don't know necessarily who's in the room, what their unique situations are, to make sure you're always being as inclusive as possible. It's the same principle we have with our other inclusivity efforts, right, around LGBTQ youth, trauma-informed work with youth. You know, you never know what somebody's experiences have been, and so it's important to keep that in mind. Disability inclusivity is another area, so the same goes for young parents. So now we get down to a little more concrete. You know, these are great overall principles and a tone to take on, but how can we make small, defined changes in the way we talk with and about young parents? So here we've put together a table of just a few examples that come up very frequently. You'll notice with all of these examples, the idea is we're trying to become more gender inclusive with our language, and we're trying to use language that is going to avoid judgments or assumptions that we're making about people's identities or about their relationships. So I'd like to talk through these just a bit more. The table explains some of this. First of all, talking about young parents, you may have noticed throughout this webinar, I've said young parents or pregnant and parenting youth versus just saying teen moms. The reason for this is there's a couple different reasons. First of all, the idea of including young dads when we talk about young parents. So often they're left out of the conversation, and they really shouldn't be. And we don't want to overlook them in our support programs. So saying parents, or saying young moms and dads. Parents is a kind of nice gender neutral term. We have to recognize that some people who are pregnant or who have had a child may not identify as female, and therefore kind of saying young parent versus assuming young mom is a nice change to make, to be able to watch for that. People differ about what term they'd like to be called. So originally when we put this toolkit together, we suggested the change as young parents. And then we had some of the young parents in these programs say, like, I like to be called teen mom. I like to be called teen dad. I like to take on that identity. And that's important to me because I think, you know, I want that visibility. I want people to know I'm here and in this community and see the work that I'm doing. So great. I would use that. As always, we let other people inform what language we should use in any particular program or situation. However, we've also heard from young people that they like to use maybe young parent versus teen parent, because we know that there is an inherent stigma, unfortunately, in our culture around teen parents. So saying young parents kind of creates a little bit of distance from that, and also recognizes those who are not teens anymore, but perhaps in their early 20s, who still need additional support services. So that's one language change that can be made. Another one is when we talk about relationships, phrasing it as partner or significant other, maybe instead of boyfriend or girlfriend or husband and wife, Just because somebody has had a child doesn't necessarily mean that they are in a man and woman relationship. In fact, we know statistically that LGBTQ plus youth are 2 to 3 times as likely to be involved in a teen pregnancy as their heterosexual cisgender peers, for a multitude of reasons. So maybe saying partner or significant other, you can avoid kind of awkward assumptions you may be making about the style of the relationship that they're in. I think it's also to be important that you may not know a parent's kind of relationship or romantic situation. So they may or may not have a relationship with the other biological parent. They may or not be planning to stay with their current partner. And so since we don't want to make assumptions about this and don't want to define for somebody what their relationship is, using more general terms is one way to be open to that. And so they don't have to correct you about what their situation is and who they might be dating or involved in co-parenting with. A third one is, instead of saying unwanted pregnancy, switching to unintended or unplanned pregnancy. Unwanted is a really difficult term. That's got some heavy emotional content to it. And we don't want to put an unwanted label on a child. That won't serve them throughout their lives. Young parents will tell you that pregnancies they've had, they may have been unplanned, but the child is very wanted and loved and valued. This pregnancy may just have been mistimed, so this youth maybe was planning on having kids and is just having them sooner than expected. We also need to recognize that not all teen pregnancies are unintended. About 3 out of 4 are unplanned, but 25% are planned, and therefore we need to be supportive of their decision. Lastly, this is a little more specific when it comes to sexual health education programs and teen pregnancy prevention programs. When we talk about our health objectives and our educational objectives, instead of saying our goal is to prevent teen pregnancy, I think a more accurate statement is that our goal is to ensure future pregnancies are planned. Because now anybody who is a young parent or who has gotten pregnant, if they hear the goal is to prevent teen pregnancy, what are they going to think? Like, oh, you missed a goal with me. I am pregnant, or I have a child, right? But we can still serve that young person very well. They still want information about healthy relationships. They still want family planning services. They want to know about sexual orientation and gender identity. This is all education that's still valuable to them. But if we put the goal so narrowly about to prevent this from happening, but it has happened, then we leave them out. So instead, to be more inclusive of everybody in the room, no matter what their pregnancy or parenting situation is to say, we want to ensure future pregnancies are planned. We want to give people the tools they need to make decisions about their reproductive choices going forward. Now we get into common myths and stigma about pregnant and parenting youth. We struggle about whether or not to include this because, again, we don't want to repeat a lot of the negative perceptions of young parents that are out there. However, we feel that it's important to acknowledge them, that they are still circulating, and help people feel empowered to interrupt some of those narratives and then change them in ways that highlight the strengths and the capacities of young parents. So this content, I have to give credit to a group called Young Women United, who did a white page report in 2016 called Dismantling Teen Pregnancy Prevention, where they brought up a lot of the narratives that they were hearing and gave us language to counteract some of those difficult myths. So briefly, we've heard the phrase, young parents are drained on taxpayer resources. A lot of the statistics around young parents highlight that economic burden. We need to acknowledge that teen pregnancy is not just an individual issue. When we think about the concentric circles of the social ecological model, all of our public health interventions need to focus on more than individuals and consider the other environments they find themselves in terms of their interpersonal relationships, their immediate community, and also a sense of a culture at large. So really, due to systemic inequities, most young parents would follow the same economic trajectory whether or not they became parents. Their teen parenthood is not what's at issue with the financial struggle. It's a part of it, but we have to consider all the community that they find themselves in. Another one that comes up is this idea that young parents are babies raising babies. You know, they're still kids themselves. This is not something that they're able to do, and that's just not true. Many young people today are taking on adult responsibilities, financial support and caretaking of siblings, of parents, whether or not they're parents themselves. And so many young people are already capable of this with some additional support and guidance. Also, you'll notice a lot of the data is around teen mothers. That's what we've included because that's what we have access to. Unfortunately, there's not a lot of data and research on there focusing on young fathers. We know that they're facing additional struggles, just like teen moms, but we just don't have the formal numbers. And I think that's an area in which we can expand our work more. But 73% of teen mothers are over 18, which does make them legal adults. The third myth is, and this is a really tough one, this idea that they've ruined their futures, because we see statistics about school dropout, we see statistics about they're less likely to pursue higher ed, and so this gets boiled down into young parenthood. You know, back to that graphic at the beginning, they're giving up all these opportunities. However, when we speak with young parents in the MyApp program, so many of them report feeling more motivated to finish school. They say, I have this additional responsibility to my child to be the best I can, to make sure that they're provided for, that they have a future. I want them to look at me as their parent and be proud of me. And so they really do want to finish school and look up different options for careers and pursuing other opportunities in their life. And finally, there's a lot of narratives about what's going to happen to the children of young parents. And what we see from Young Women United is data consistently shows the age someone becomes a parent does not determine or predict their child's future. That's really not at the heart of a lot of that data. It comes instead from this idea that if we're not providing enough social and community supports for young parents, then of course they're going to be struggling financially. And then of course we're going to see that they're not able to provide as well. There's a cycle of poverty that we need to acknowledge, which goes along and is a context for a lot of this data. So if we can intervene early with young parents, we know that their children can thrive just like them. On the last page here of the toolkit, we just have a thank you for anyone who's taken the time to read through this. And we want to provide some resources for those who are interested in this work going forward. So some of the websites that we've included are myhealthyfamily.org, that is Michigan specific from the MyApp program. A national initiative is noteenshame.com. This was a social media campaign that came up around fighting back against the stigma of young parenthood. And they've got a lot of really wonderful graphics that you can share. So that's a great awareness raising initiative. So I recommend you check that out and you can download those graphics. Black Mamas Matter is a wonderful organization out of Atlanta, which looks at the intersecting identities of women of color who are young parents. We've got Young Women United, who I mentioned before, and then Forward Together, which is formerly of Strong Families New Mexico. has a lot of really good info. Unfortunately, I'd like to include more young father-specific resources. Unfortunately, they don't really exist, but if anybody's interested in that, as I say, Michigan has got a really wonderful fatherhood program that has developed, and I can put you in touch with some of the guys who are involved in that work. So there you have it. So the next steps with this toolkit right now is MDHHS is doing a formal review of the content to give it their stamp of approval, and once we get that, hopefully in the next few weeks, what we're going to do is put that up on MOASH's web resources page. It'll be easily downloadable and shareable. We hope you do. We hope you find some value in the content. Maybe you knew a lot of this before, but hopefully there's something that can be valuable to you in your day-to-day work. Encourage you to check out the MOASH resource page. Here you can see graphics of all the different handouts that we have. Most of them are a simple 2-pager around teen parent rights in different areas. And then, as I referenced before, looking at the intersection of LGBTQ+ identifying youth and pregnancy. My plan is to also, anybody who is registered for this webinar, once we have the toolkit and it's able to be shared broadly, I can send it to you in an email. So you'll have access to that. If you've registered for this webinar, I'll make sure to send that to you directly. But you can contact me at brittany.patella@moash.org for more information if you want to follow up or give feedback on anything you've seen on today's webinar that we've spoken about. Thank you so much for listening. I want you to be aware of some other upcoming initiatives about young parents. So if you want to join us for our other Michigan Youth Parenting Awareness Day webinar, it's going to be this coming Monday, March 25th from 7 to 8 p.m. The graphic there on the right gives you the registration link. What we're going to be talking about are kind of 2 different works. So we've got Cole Williams, who, if you haven't heard of Cole, is an incredible motivational speaker. He has done work with a lot of young dads. He's done a lot of work with incarcerated youth. He's been our partner on the MyApp program for years. This year, he's going to be our MC and panel moderator at the Youth Thrive Teen Parent Summit. Just an incredible person. One of the many things that he's done is started to develop a comic giving depictions of teen dads as superheroes in their child's life. And you can see a little snippet of what that material looks like at the bottom of that graphic. So on Monday, we're going to be talking about how teen parents are represented in different graphic art initiatives. So Cole will be sharing his work that he's been developing and what artistic decisions he's made. Then we'll also be looking at a graphic novel called The Amazing True Story of a Teenage Single Mom, and discussing what artistic decisions people make. So it should be a fun kind of book club, informal art review experience. I think it's going to be a really good time, so I hope you'll join us for that. The other thing I want to be aware of is if you're working with pregnant and parenting youth, we hope you'll consider joining us for the 2nd ever Youth Thrive Teen Parent Summit. You can mark your calendars now. It's going to be Friday, May 10th, lasting from 10 a.m. to 3:15 p.m., and it'll be held at Lansing Community College's downtown campus site. If you're familiar with the Gannon Commons area, we'll be around there. This is free and open for any expectant or parenting youth. We'll also have a few staff members for people who run parenting programs come as chaperones for the young people. The day has a number of things in store in terms of breakout sessions. We're going to have a panel of former teen parents talking about the successes they've found and giving advice to our current teen parents. We'll have resource tables from a number of different colleges. We're going to have somebody from the Michigan Financial Aid Office come and talk to young parents about financial support that's available to them. We'll even have kind of help with filling out an application for financial aid right there. We'll also have different resource tables from community organizations. And finally, we're going to have a kind of networking space, because I think there's young parents across the state that'll really have a wonderful time meeting each other, talking about how things are going, sharing their experiences, talking about different strategies they've used with the different challenges that they've encountered in their lives. Last year was a blast, so we hope you'll be able to come. If you have any other questions about that, you can go online to moash.org/youthrive. We've got a frequently asked questions section, which talks about many things involving like transportation. We're able to provide some support for that. We talk about, why we've decided to invite pregnant and parenting youth and ask them to arrange for childcare for the day. So there's a lot of information to be found there. So that is the content I have for you today. I hope you've enjoyed looking through the toolkit. We look forward to releasing that soon. And Stephanie, I want to check in with you to see if there's been any participant questions throughout.
No questions at this time.
Okay. We've got another couple minutes. So I'll just go ahead and pause and see if anybody has any thoughts, comments, or other questions about the material presented today. All right, in the chat, I've just put 2 different links to MOASH's website. The first will tell you more about Michigan Youth Parenting Awareness Day. The second will tell you more about the Youth Thrive Teen Parent Summit. The third is going to tell you more about the MyApp program MOASH is partnered with and is involved in all of the initiatives we've discussed. And here is my email if anyone would like to follow up offline. So thank you all for your time. Happy MyPad, and we look forward to releasing the toolkit to you all in a few short weeks. Thank you so much.